Hello, my name's Matthew Lockyer. I'm a GP. I work here in Suffolk. This is my surgery, and I've been practicing for 30 years. And I've been asked to talk to you this morning about the truth about celiac disease. Now, of course, as a general practitioner, I'm not a specialist, but I'm going to give you a GP's view of what celiac disease is and how it's changed a bit over the years that I've been in practice. If you asked a medical student what celiac disease is, they would say to you, it's an abnormal immune response to alpha-gliadin resulting in villous atrophy in the small intestine and malabsorption. Well, what does that actually mean in real life? I think what we have to do is begin by just revising a little bit about what's going on and how celiac disease causes its damage. Celiac disease stops us absorbing our food. Our intestine begins up at the mouth where we chew our food and break it down. The food's further broken down in the stomach, and then it passes into the small intestine. You probably remember that the small intestine is a bit like swimming through a sea of seaweed. It's got lots of fingers that are out there, and they're out there so they can pick up all the good things that are passing through, all the nutrients that are contained in the liquid that goes through. And we call the fingers villi. Now, for some reason, some people inherit a tendency to be allergic to one of the proteins that we find in wheat, barley and rye. It's called alpha-gliadin. Now, when they're exposed to alpha-gliadin, they behave as though they're fighting off an infection. They form antibodies. And those antibodies persist in the system. And unfortunately, they recognize the villi as being something foreign and part of the enemy, and they destroy them. So instead of having an intestine that's got lots of lovely fronds that are picking up all your good things from your food, you get a smooth tube that the food passes through, and you can't get all the things you need from it. So when we see people who have celiac disease, most of their symptoms are usually going to be around the intestine. They might be getting some abdominal pain. They certainly often have diarrhea because all the things that pass through that can't be absorbed tend to make it difficult for you when you're trying to get rid of the waste products. And of course, if they're a child, they can't grow very well. If you're an adult, then some of the things that you would do normally that depend on having plenty of nutrition, such as having plenty of energy, but also things like getting pregnant, become much more difficult for you. Now, most people who are going to eat wheat don't have any problem with it at all. But in certain families, you've inherited that tendency to be susceptible to mounting this response to the gliadin. And those families are also prone to some other diseases because this tendency to produce antibodies that are damaging seems to go with a cluster of immune markers. And those people who get celiac disease will often come from families where you might find type 1 diabetes is more common and some forms of thyroid disease. Now, one of the things that we've learned over the years is that actually celiac disease is much more common than we thought. Lots of the chronic diseases that doctors see, that's things like diabetes, thyroid, rheumatoid arthritis, high blood pressure, are often given as having a prevalence, that means the amount of the population who've got them, of about 1%. Now, if you're a GP like me, we look after about 2,000 people, give or take. And that would mean that most of us would be looking after about 200 people with celiac disease. And quite a lot of those people will not only have celiac disease, but they will either have themselves diabetes or thyroid problems, or they'll come from families where those problems are prevalent. Interestingly, there are some clusters in the world where celiac disease is even more common than that. One of the best known is in Southern Ireland. And there are some areas of the world where you don't see very much of it at all, because actually the wheat, barley and rye that cause it are not part of the diet. So in Southern Asia, where they eat a lot of rice, we don't see very much celiac disease at all. One of the big things that's changed in my generation is the people that we look at it for. This is the book that I used when I was a medical student to learn about pediatrics, that's children's medicine. And if we look inside, we'll see that I marked it 1983. And on the cover, there's a picture of an unfortunate child who isn't growing, who's got a rather swollen stomach, and who looks thoroughly miserable. And that was the classical picture of celiac disease when I qualified. That was what you looked for. We now, of course, realise that celiac disease isn't confined to children, it isn't confined to people who are actively unwell, and we screen for it for a whole variety of more minor symptoms than the child like this, although this can still be one of the ways in which we detect it. But in fact, I would say these days I find it more in adults than I do in children. Of course, the interesting thing about that is that this child would have been treated by a diet that is free of gluten. The treatment still remains a diet that is free of gluten. So we are better at diagnosing it, we're more aware of it, the treatment remains the same. We are perhaps better at making sure that people with celiac disease are absorbing the things they should. So we check their iron levels regularly, we check their B12, we check to make sure that they're thriving generally, and we also check their vitamin D and their bone density. One of the things that we are aware of with celiac disease, particularly if it isn't looked after well, is it can be associated with a rare condition called lymphoma, which is a cancerous disease occurring in the small bowel. Now, I personally have never seen a case, but we do also say that you should be aware if you see illness in people who've had celiac disease for a long time. And of course, the other thing with celiac patients is that we have to be aware that at any time they could develop some of the other things we've mentioned that are associated with it, like thyroid disease and diabetes. So it's probably a good idea for most patients with celiac disease to have checks, perhaps every year or 2 years. So we've talked about the fact that people with celiac disease must avoid products that contain wheat, that contain barley, that contain rye, and quite a lot of the people who have it must also avoid oats. We know that some people with celiac disease can eat oat-containing products, but there's a bit of crossover, and about 1% of those people will also be allergic to oats as well. One of the things about celiac disease is that for many, many years it was a kind of Cinderella illness, and the public awareness of it was quite low, and it's still not great, but it's certainly arising. And one of the reasons for that is that there's recently been quite a lot of interest in the content of our diet. Food allergies are something that I'm often asked about as a GP, and there's quite a lot in the press and the media at the moment about how our diets changed, and you'll see a lot of that's written about things like paleo diets. These are diets before those grains that we mentioned really sort of entered the food chain for us when we became farmers, when we were rather more hunter-gatherers. So at the minute, there are a lot of people who are interested in diets that are generally free from. And you'll see that there's actually quite a lot in the supermarket shelves, and quite a lot of foods, even foods that didn't include gluten in the original recipe, things like salad creams, will now advertise themselves as being free from, because partly they want celiac people to know that it's actually safe for them to have it, but also free from is generally becoming quite an interesting selling point. So as a GP, do we think free from is just like a food fad or a fashion, or is there some evidence that you can have problems with these proteins but not actually have celiac disease? Well, the answer is interesting, and a recent study that was performed in Scotland suggested that if you took people with irritable bowel syndrome but not celiac disease, they could tell without being told whether or not the diet they were being fed over several months contained gluten or whether it didn't. So we are still wondering whether or not there may be an allergy component for some people, and although they don't have celiac disease, they may still have a problem with gluten. And I think further research may tell us that our relationship with wheat, rye, barley, and for some of us oats, is more complicated than we had originally thought.